Okay, we're going to talk about AFM. There's the objectives, blah, blah, blah. Let's go. Okay. This is the kid that I had. So this is a 2-year-old that comes in. He was actually brought by EMS. He went to his pediatrician's office. But the history is he's had fever for 5 days. He's been kind of... Parents use the word lethargic all the time. I hate that word. It's a stupid word. And the reason it's a stupid word is because if a parent comes in and tells me this kid's lethargic, he's getting a spinal tap, he's getting imaged, he's getting all kinds of things done to him. This cord is lethargic, right? It just sits there. And I do that with my stethoscope. Did he look like this? And they go, no, he's not lethargic. Is he listless? Is he sleepy? Is he less active? Fine. True lethargy is rare, and when you got it, you're in deep doo-doo. All right. So the parents probably tell me he's been lethargic, you know. His pediatrician saw him a few days ago, said, you got the virus, which as it turns out is true, and sent him home just with, what we always do, supportive care and see how things go. Then the parents tell me, well, for the past couple days, he hasn't been pooping a whole lot. He really hasn't peed a whole lot today. He went back to the pediatrician, and the kid looked kind of weird, so they sent him over to us. He's been healthy. He had a little erythema infectiosum a few months ago, but, he's fully immunized, and everything else seems to be fine, and the kid has been nowhere. So I'm going to give you the pertinent positives on this. So those are his vitals. No, he's 2, so that's not terrible. But the thing about this was he was sleeping. He was just laying there. And you can wake him up, but he's just kind of just laying there. So he's a little tachycardic for not doing anything. You can wake him up, and he goes, and goes right back to sleep. And that's that. He looks tired. And I just put the pertinent positives on here because, you want to laugh? Try to read a medical student H&P and see what you got. You uses seatbelts and goes to the moon and all. It's the ER, sick or not sick, right? So he's sleepy, wakes up. There aren't any focal deficits, but he can't walk. And you can sit him up, so he doesn't seem to have any truncal ataxia. He sits up like this, perfectly fine. If you get him to walk, he takes a step and then kind of buckles. And so you pick him up, and being the cruel person you are, say, walk! And he can't. So he's doing this weird kind of, the Brack drunk walk thing. He seems to be feeling everything. He does have diminished reflexes. He's got good coordination. How do we just coordination to a 2-year-old? I woke him up. I said, look, here's a block. And he grabs it. And he's able to put it back in with the other blocks. And so he's doing that, which is nice. But all throughout, he just seems to be sort of diminished. He speaks a little bit, but grossly, he seems to be okay. You don't find anything in his muscle exam. Why do we care about AFM? Because these guys and this guys and these guys and those guys and those guys all care about it. It made big-time headlines last year, right? It was everywhere. You couldn't turn on the news with somebody talking about the polio thing that's getting kids and all that, right? And for good measure, I did put in a picture of an iron lung. If you want to see an iron lung, I don't know where it is now, but there used to be one at the basement in Brackenridge. And a couple years ago, the pediatrics residents during immunization advocacy day dragged that thing out and put it in the rotunda of the state capitol, and they were like, look, see, this is why we like the IPV vaccine. So there's still one out there. But this is why. It's been nationwide phenomenon, basically. The scary things are, and really you can just kind of go with this slide and be done with it if you wanted to. No one knows exactly what causes this. No one knows what the treatment, the ideal treatment is for this, and the morbidity can be very, very significant. So these are all headlines that came in through the news. Okay. Who's from California here? Anybody? All right, I'm going to say it anyway. The source of all bad things in the world, including AFM, guess where? I just noticed that's backwards. I didn't mean to do that. That's not intentional. Sorry. That part's, okay, I'm going to say this. All right, so in 2012, my friends in California noticed that there was a bunch of weak kids that were all associated with this weird respiratory disease outbreak. These kids all got weak. And we kind of left it at that. Then, 2 years later, it sort of went away. 2 years later, some folks in Colorado said, hey, you know what? Same thing's going on. And when they imaged these kids, they had MRI findings that looked consistent with polio. And we'll get to those in a second. So the Colorado guys and the California guys got together, and they did a whole bunch of studies, and they figured out that, hey, you know what? These cases were all very, very similar. They all had some kind of preceding viral upper respiratory infection, followed by acute weakness, and in some cases, just flat-out paralysis, could not walk. So they called the CDC. So that's the first mistake, is calling the government, but they did, and the CDC actually said, hey, that's something, and they issued a health advisory notice, and by October of that year, already 64 cases have been reported. So within a couple of months, we got this weird thing going on. This is as of November of last year. So if you don't want it, you can live in these boring states. But oddly enough, California had no cases last year because they all moved to Texas. Aha! There you go. They're all in Austin. Okay, here we go. All right. I like to dress my talks with pretty art. Y'all know what that is? That's Van Gogh's house. That's his bedroom right there. Van Gogh was crazy, but anyway. So you can look at that. It's pretty. But we're going to look at this. How common is this thing? It's rare. About 1 in a million is the average. About 1 in a million. As of back in 2014, after October into November, they had 120 cases. And since 2014, 400 cases have been reported. In 2015, they finally decided we're going to start doing standard surveillance and reporting this when it comes into offices. It's been seen in Japan, Canada, and Europe. It's usually seen in young kids. The California average was 9. Colorado had about 11.5. The average is about 4 years of age. So it's not seen typically in teenagers. It's usually the younger kids that get this. And again, no one knows why. So in 2014, 2015, they isolated enterovirus D68. That's it right there. Everybody has enterovirus. That's the problem. It's an extremely common virus. If you're coughing, you have congestion, you're pooping, you're vomiting, you got entero. And there's a bunch of them. But this is what was isolated from California and from most of the Colorado cases. Unfortunately, it was only isolated from nasal swabs and nowhere else. It wasn't in spinal fluid. It wasn't in blood. It wasn't in anything. Just the nasal swabs, which is a problem because if I come here and swab everyone for enterovirus, about half of us are going to have it anyway, and we're not sick. It was the most common virus isolated. It was clustered that they've noticed during enterovirus D68 peak, which is typically fallish, early winter, late fall. There was one person since 2014 that had enterovirus D68 detected in the blood who had AFM. It's the only person. No one had it in their spinal fluid. And they've thought that maybe the cause of this is enterovirus, because you give a mouse enterovirus, you paralyze them. Now, that's kind of cruel. But is that the cause of the paralysis? And so the thinking was it's D68 that's causing this. This is what it does. Peaks, August, October, December, dies down, peaks up again a little bit. That was in 2015. It likes even numbers, picks up again, dies down a bit, and peaks again. So on even-numbered years, at least since 2014, between August and November, you get peaks of AFM. And by the way, that also happens to be the peak season of most viral infections, including entero. So what happens? All right. So you get this URI thing, and the kid goes see the doctor, or goes see me, and we go, you got a virus, go away, and we send the kid home. And then, well, we'll get to what happens after that. 80% of kids have some kind of preceding viral URI, and 75% of reported cases had fever prior to this. So fever, cough, cold, the usual sorts of things. Then you start getting myalgias, and this is the weird thing. Kids have been diagnosed with AFM all complain about their legs hurting. It hurts to walk. And in fact, this other kid, our first case, he initially, his complaint to his parents was, my back hurts, my legs hurt, I don't want to walk. And then when they got him to walk, they noticed the weakness. So myalgia seems to be the big thing. Some kids do get mental status changes. You get headaches, that sort of thing, like a meningitis kind of picture. But it's rapidly progressive. And we'll tell you what happened to this kid in a minute. But it goes from, I really can't walk, to I can't breathe within a matter of hours in some kids. So it's an incredibly rapidly progressive, fast illness. Cranial nerve involvement is variable. You don't really see that usually, but you typically will see either upper or lower limb weakness. Neurogenic bladder or bowel, that's interesting because that kid was constipated, that kid hadn't peed, and you have to kind of wonder, was that part of it? And in some kids, they progress to respiratory failure. So they have a couple clinical criteria. The first thing is you have to have some kind of paralysis. Makes sense. Second thing, if you image these people, and it's an MRI with contrast, you will see that they've got lesions that is restricted primarily to their gray matter. And so that's what this is. You see this is all gray matter here, it's nice and black, and then you see this nice white line going down? He's got one there, he's got it right there. It involves one or more segments, so this guy involves 1, 2, 3, 4, 5, 6, 7, I don't even know what's going on down here. So if you have these criteria, you got AFM. If you have limb paralysis and we do a spinal tap on you and you have a bunch of white cells, you have a probable case. Now, what we'll typically do, and you'll see in a minute, they'll get a spinal tap and they will get imaging, but these are the criteria that people are using to diagnose AFM. What do you do about it? Well, you got to think about other things first. Transverse myelitis looks like this. Guillain-Barré can look like this. Any demyelinating disorder that kids get post-viral will look like this. Chronic conditions are a problem. Some of these kids that get it, you know, if you are in the comprehensive care clinic and you've got a trach and a G button and maybe CP and you're not walking great anyway and you get this on top of it, you might get into a lot of trouble. For us, you take appropriate precautions in terms you don't want to get enterovirus, although adults get it and we typically do okay. We do physical therapy in these kids, and we'll talk about treatment in a minute. And then what do you do with them, and we'll get to all that. So here's the management of it. Supportive care is by far away the only thing that people seem to agree on. Some of these kids get intubated, some of these kids don't. It kind of depends on how they're handling their illness. Steroids, that's what we typically will give. The thing about it is, by the way, the initial recommendation for the CDC was not to do any of this stuff. The steroids now, they're saying in some kids, if you give it, they get better. So they're not either for or against it. They're saying you could try. IVIG, I've always said that you can pull the plug on me after I've gotten IVIG on steroids and it doesn't work. IVIG fixes everything. This is one of these things that, again, we're not really sure. Is it really going to help or not? But we give it, and there's anecdotal evidence to suggest that it does. So there you go. Antivirals. The whole thing about antivirals was they thought that, there's actually a enteroviral medicine called pleconazole. Some people tried acyclovir, some people tried valacyclovir, all that stuff. As it turns out, antivirals don't do a thing for AFM unless you think that the virus might be herpetic. And in some kids, they'll have that, but not on any of the AFM cases we've had, in which case it's just another paralysis from a different virus. So we typically won't give that. Some people are giving interferon. Interferon has all kinds of bad side effects, and people tend not to use it. People have tried Paxil. So, at least you won't be depressed that you can't walk, but it doesn't seem to do much good. People have tried plasmapheresis, which is a whole big ball game, and that, as it turns out, doesn't seem to be doing anything, and truthfully, it might even be harmful. So really, at the end of the day, all you can really do is supportive care, steroids, and IVIG, and these two are kind of controversial. What happens to these kids? Well, almost 90% had persistent neurologic deficits, whether that was difficulty walking, difficulty breathing, whatever it was. Almost 90% of them had some deficits. 9% fully recovered, and the death rate, while low, was still significant. So what about Austin? We've had 4 cases, and you go, 4 cases? Yeah, but when it's 1 in a million, that's kind of high. 2 of them had complete neurologic recovery. 2 of them still have focal deficits. They can't walk, is what their issues are right now. They were treated with IVIG and steroids, and that's what the infectious disease guys and neurologists are doing at Dell, because, again, we really don't know what else to do with them. So who cares? Why should it matter for EMS? Well, because couple of things. One, these are the kids that, and again, the crazy parent calls you and says, he's not walking, and the kid looks okay, and this kid admittedly didn't look all that bad, he just wouldn't walk. Walk the kid and see what they're talking about. It's enough that if a parent's telling you they're concerned, especially with this, parents are nuts, we know it, but this is the kind of kid you do want to transport, or at least, suggest to the family that, maybe we need to take a look at him and get him rolling. The whole decontamination thing, no one knows just how, since we don't know the actual cause of this, how contagious is this thing? So they do recommend that you just do, typical decon things in your units and use appropriate PPE. More importantly, it's the progression. Sometimes kids will seek care when they're starting to kind of circle the drain. We have all seen this, right? Or the parents won't really quite understand that the kid really is getting sick, and then they call you guys. And there's been a couple case reports of kids on the way to the hospital just have respiratory arrest. So these are the kids you want to be ready to take their airway over and get their lines started and all that kind of thing, and be prepared to manage them that way, because when it is rapidly progressive, and there are kids that just stop breathing, and there you go. So that can happen. So what happened with our kid? All right, well, on day of hospital number 1, he had an LP, he had an MRI. The next day, he started to not breathe so good. So he was sent down to the immediate care unit to get watched a little more carefully. His mental status had decreased. He wasn't quite recognizing people anymore. He did not get intubated. He was placed on some high-flow oxygen and seemed to perk up. He was transferred back to the floor. He spent 9 days in the hospital. He did get IVIG. He got steroids. He was discharged with a taper. He had an aggressive physical therapy regimen and has to follow up with all these guys. And as of right now, he seems to be recovering his function pretty good. He's one of the ones that wasn't all the way recovered, but he's getting there. In case you're wondering, that's his x-ray. There's the poop, all poop. Very, right? Now, the radiologist will tell you that they'll call any x-ray constipation if you ask them to, right? I mean, that might be normal for some people. Not asking any questions, just saying. But apparently, he is a champion pooper, and that's what the dad said. And so this was probably because of his AFM. There's his MRI. So, and I'll get the other one too up here. So you can see, right, it's a little hard to see, but see that white all the way down right there? That's his involvement. And then his discharge MRI looked like that. Way, way better, which is why he was walking better and doing everything better. So what we know. Okay, bottom of the line. Remember Mr. Owl? I love Mr. Owl. I had a resident the other day goes, "Who's Mr. Owl?" And I was like, "You jerk." Anyway, all right, so it is likely the result of some kind of neuroinvasive infectious process, probably viral. The exact pathogen, we don't know. Everyone's betting that it's enterovirus, but who knows? It's seasonal, it likes young people, and it's rare. We've all talked about the clinical findings. Typically, URI illness preceding the weakness after that. People complain about limb pain, and then they're very weak, either the upper extremity, lower extremities, or both. It can be rapidly progressive. There are no real lab findings that confirm it, but if you do a spinal tap and there's a bunch of white cells in your spinal fluid, this kid had that, combined with imaging, that kind of cinches your diagnosis. Unfortunately, and this is sort of the whole, we could have just skipped to this slide if you wanted, no one knows what to do about it. There is no data either for or against saying how you should treat this. The one thing people can agree on is aggressive physical therapy seems to help, and supportive care seems to help. Most people, most institutions, most pediatric ID guys and neurologists will say start IVIG and start steroids because it seems to help. Everything else doesn't seem to work at all. And I feel like this guy, this is a famous, The Doctor, I think it's called, and they're watching this kid, and this is basically all you can do is look at the kid, whether she gets better or not. And that's sort of how AFM is. You start whatever treatment you think is going to work, and you just sit back and wait, and it might get better, it might not. And on that fun note, are y'all feeling good about yourselves now? Yeah, that was, all there, depressed? Okay, cool.